you are not at Imhotep Circle. It's next door. This is NWB. Specifically, Joanna Hagen approached us to do a talk on nonprofit startup for naturopathic students. And so this is co-sponsored by the Career Center at SC&M. Basically, we decided to break it down into 5 parts, which because of necessity might become 4 parts. I'll get to that a little bit later. So this first part, we wanted to set the foundation for creating a solid, engaging project that engages your passions and has a good, ethical, philosophical background to it. We're not going to talk about the paperwork, the marketing, the fundraising, building a board, taking care of yourself. That's all for later. So I am Dr. Sean Hesler. I'm the Executive Director of Naturopathic Global Health Series currently. So a little overview of this series. Today we're going to talk a bit about location, so choosing where you want to do your project, which populations, integration with other groups or government organizations, just touching over that. That's a whole series in itself. Different models. We're going to look at 3 different models that I believe are pretty successful, and you can take pieces of those models to learn from. And then also just a little bit of introduction to game planning, how you want your organization to work, creating some kind of core values, commander's intent. Next class, we'll be talking more about building the nonprofit, like the Grizzly, how do you write your bylaws and your 501c3 paperwork. It's still important to come to that class, even if you don't plan on doing a startup, because you want to know how startups are done so that you can identify a quality nonprofit that has their stuff together versus one that doesn't. And one that doesn't mean you should necessarily avoid them, but you need to find out what you can do to help that organization work. We'll also touch a little bit on marketing probably in the next class too. So marketing and fundraising for class 3. This one is kind of pending. I am going to Haiti early, so I won't be here to teach this. Dr. Guy will be in Portland, so Dr. Zena may take this, or we'll just kind of smush the content to the classes before and after it. For budgeting, again, not that exciting, although once you actually do it, it's really exciting because that's as close as you can get to things happening without the risk of them actually happening yet. You just get to talk about it and dream about what you want to budget for. Getting donations, and then some on in-country operations, like doing assessments, continual monitoring to improve your project, managing employees, stuff like that. Again, in a 45-minute period, there's not a whole lot we can cover, but we've changed the format to kind of address that. And then step 5, taking care of your finances and your sanity, both of which are probably equally important, because running out of money is a big problem that hurts a lot of nonprofits and new NDs. And also, running out of sanity and burning out is a major problem. Has anyone seen the documentary Living in Emergency about Doctors Without Borders? It does a good job of highlighting this. It follows a few doctors and directors who have worked for Doctors Without Borders, and some of them have done better than others at coping with the horrible things that they're seeing. Doctors Without Borders is civil war, genocide, massive disasters, people dying all over the place. So that's a great documentary for getting a little taste of some of the gnarly stuff that goes on. Got a little beat going. Probably won't show up on our video. But. So the style of this, rather than talk at you, I wanted to make kind of a team-based workshop. And I kind of like that we don't have too many people to start with because it could be kind of a nightmare. This is all new material that we haven't delivered before, and I'm hoping that the format works out. So I could just stand up here and talk at you and read off PowerPoints. I'll try to keep that to like less than half of the actual thing. The rest of it we'll try to mix in groups. So more experiential. We'll make kind of a few mock nonprofits to address the inequities that we see in the world. And the other thing, I don't want to give you all of the information I could give you. I want to give you probably the 20% that's most useful, that produces 80% of the output. You can look up the other 80%. We'll probably give you a couple fundraising ideas and then have you think about fundraising ideas and actually plan out a fundraiser versus me giving you a list of 100 fundraising ideas. You can Google that. That's all over the place. So stick to that style. The goal here is to help build up the knowledge base within the ND student community to hopefully inspire you to have part-time or hopefully full-time careers in global health. I think this will also help you starting a private practice too, so don't run away if you're not totally sold on doing global health full-time. You have a lot of time to think about this, but that's basically the purpose of both the chapter and this talk. A little bit about me, a little bit about NWB. NWB started in 2003 as a Spanish-speaking club because the Hamilton Elementary Clinic, which is an extended site of SCNM, different nomenclature for different schools. It's in a primarily Spanish-speaking community, so there are a lot of translators at Hamilton Elementary when you go to work there. The idea was, let's have students practice medical Spanish so they'll be more useful. So it's called Club Médico. In 2004, it turned into NWB, more of a community health focus. So I was president from 2007 to 2009 of the student chapter before there was an NWB Global, like an overarching nonprofit. I graduated in 2010. Those two things are backwards. Next. Right after I graduated, my wife, Dr. Sarah, and I went to Mama Baby Haiti and started their in-country operations. We were both also the co-medical directors. So, like many of you who want to dive into global health, we dove into it. And although we had a lot of experience in both Rocky Point and another project in Mexico called Mar de Jade, the startup is an entirely different animal, and so we kind of learned the hard way. It would have been really nice to have something like this to give us a little taste of what we should be doing. Shortly before we left Mama Baby Haiti, we decided now is the time to make NWB a nonprofit. We incorporated in Oregon, nonprofit status as of August of 2011. And so we took our student group, or then student groups, we had Best Year University on board also, turned it into a full-on nonprofit, made NWB Global, board, mission, vision, all that, bylaws, all that kind of stuff. So at the time, I was kind of the founding director of professional academic affairs because I love students and I love the profession, and I wanted to be the one to help really push global health and push NWB within those two things. I'm now the executive director, and I'm leaving for Haiti again. Dr. Sarah and I are leaving for Haiti again on the 28th of January, hence the rush. Let's first talk about finding a target or a set of targets for your project. Location is very important. Identifying the patient population you want to work with is very important. Before you start talking about who you're going to put on your board, the team you're going to build, the marketing, the fundraising, you've got to start by honing in the exact project that you're going to want. So, location considerations. There's kind of an ongoing battle that should be going on in your head when you're thinking about different places to work. And these, this continuum between the amount of impact you can have and the amount of need in the community are not mutually exclusive. They're not really on a spectrum. So what I mean by this is you might say, as a general rule, people deserve to have health care. So you might, from that, go, I want to go where people have the least access to health care because we can make the most impact there. True? Maybe, maybe not. Depends, right? Because there are many more factors to consider. What are the barriers to care there? If a barrier to care is that there's been an ongoing civil war and doctors are being slaughtered, or cultural barriers to medicine, etc., you going in there might just be another failed project that's not going to help the people. On the other hand, if you're successful, you're going where people most need you, then you'll have a greater impact than if you go somewhere where the population is slightly marginalized. So think about that when you're planning on where you want to go. Maybe you're not comfortable going in a really destitute area. Maybe you just want to have a part-time volunteer practice at a homeless shelter in Phoenix, like say CAS. Whatever you want to do, we're going to kind of discuss some different ways to make it happen. So consider the resources you have available depending on the location. So one resource might be the people. Your people, people that you can get excited and on board to help you, the people who are already in the country. So one example would be, we wanted to work with Haitian midwives. So we joined up with Mama Baby Haiti, and we started doing some midwife training. An interesting stat is, unreferenced stat of course, but roughly 80% of the births in Haiti are performed by these traditional Haitian midwives who are all apprentice trained. And there have been some programs on and off to more formally train these midwives, but the vast majority of them learn from their mother or their grandmother or the other midwife in town. So they do some things very well. There's some things that they don't do well, and when we come in, we can share information. So they are a local resource in that they're already doing it. We're not coming in from the outside and bringing midwives and trying to completely replace the system that's going on there. NWB is coming in and seeking to basically augment the services that these midwives are already offering. If all the births were already done in the hospital, you might focus on working on access to obstetric care, or improving the quality of that obstetric care, maybe improving the transportation of getting women to the hospital. In this case, births are largely done at home, so that's our focus. So you have to think about the people resources you have. Natural resources. This matters probably more to us as naturopathic physicians because we're very interested in the herbs that are growing in the ways that people use them. So Haiti has a wide variety of herbal medicines that grow there, that grow very easily, that people are already using in teas. You'll hear when you're down there about a child having a cough. You ask, have you done anything for the cough? Oh yeah, I gave them this the orange leaf tea from the sour oranges. It's kind of a universal thing that they try. So doing some early research on the plants that are available is especially interesting to us as naturopathic physicians. Knowing other food sources that are available there, that's a natural resource, or it could be an artificial resource. A lot of Haiti's food is imported. Most of the rice is imported, even though Haiti grows a lot of rice. It has to do with economics and politics, and it's really complicated. But maybe you want to do something with increasing rice production so people aren't as hungry. Haiti's also really close to the ocean, so there's a lot of fish. You can do something with fishing and getting people more protein, etc. So just something to get your gears going when you're looking at different locations. Also, proximity to transportation, existing infrastructure, etc. So I want to go where my care is most needed, which is probably some remote village in sub-Saharan Africa, some remote village in Haiti, right? Very little access. They don't have a lot of transportation to get resources, etc. They're maybe the most in need, but you also might be least able to help them unless you have some way to drastically increase transportation there. It might be a lot easier for you to work in a slum of a city where people can easily fly in and out, you're near the customs, transportation is a lot less expensive, etc. Likewise for healthcare. We in Haiti are about, depending on traffic, maybe 45 minutes away from the local hospital. So if we have an emergency, we need to send someone there, we're going to have to identify those emergencies a little more quickly and be more conservative in our care, more aggressive in getting them referred out if they're going downhill. Versus if we were right next door, we might have a different model of care. We might even just integrate with the hospital itself. So take a look at what's already there and see if you think it's best to be close to those resources and augment people getting access to those resources, or if you want to be somewhere else and bring the resource to the people. I'm not saying one is correct and one is incorrect. It depends on your access. You might be a pilot or know a pilot who can help fly stuff in. Now this village is going to be a new core of healthcare that's going to be the model for the country. Partners in Health basically does that. Sustainability. By this, I kind of have two prongs whenever I say this, because it's a term that's used a lot lately. It's a really hot topic. Financial sustainability in terms of, can you literally keep the project going without leaving? And also sustainability of, if you start the project, will it keep going given the culture, given the resources, etc.? Can you scale it up? Or is it just going to be your little naturopathic thing in a bubble that's not integrating with the rest of the system? Culture, religion, politics, economics, that's a huge topic. It's going to be very individual to the area you're working, and doing research outside of your area, like Googling Haitian culture, you're going to get a stereotyped view of what's really going on there. I believe you won't really know unless you go there. Intermediate to that is talking to some people from there who also have worked there and had good experiences and been able to integrate with it. Don't listen to the people who are like down on a country. So, does anybody right now have a strong inclination as to a location or population that they would like to work with? I don't mean like, oh, I kind of like Mexico. I mean, you're like, hey, I really want to go to the Philippines or something like that. Lucci has one. Where?
Nigeria.
Nigeria. Doing what?
Helping sickle cell awareness and sickle cell patients and running the clinics in that area.
Sickle cell. Primary care. What else?
What else in that? What else?
No, it's someone else. You're finished. No one else? Don't be shy. This talk requires at least one more. Go. Jessica.
I would like to go to India and open like a clinic that does midwifery as well as naturopathic care, and integrating some of their local health conditions as well.
ND midwife, integrated India. What else? Nobody? Make something up. Make something up.
I want to do a mobile clinic in West Africa through Kenya out to Egypt, in that region.
Mobile clinic, West Africa.
Yeah.
Sounds good. Yeah.
I spent a lot of time in Southeast Asia, and I feel most drawn to go back and work with Burmese refugees in the northwest of Thailand. And the volunteer work I did with them before was teaching English, but I feel that maybe with this education I can go back and help some more.
Okay. So, Burmese refugees. Okay. Can each of you that spoke stand up? Okay. Who wants to go to India? Anybody else? Just kind of gravitate toward Jess. Want to go to West Africa? Gravitate toward Ren. Nigeria for Lucci.
My name's Anne.
And Burma. How about we spread you guys out? How about Ren comes up here? Remember, this is a group style thing, so don't be shy, get to know each other. How about Lucci comes up in this corner? And everybody else, get up. Get up. You can do it. You can do it. Do like 2 or 3 to a group. If you're on your own, that's all right too. Where are we going?
Okay.
There's no wrong answer. That worked out perfectly. Good job. Okay, now sit down. We want to have one note taker, could be laptop, paper, whatever. You're not being graded or anything. We're gonna take these groups and kind of do an ongoing thing with them. Probably we're gonna run out of time today. That's okay. So, who is familiar with SWOT analysis? Kinda, yeah. No? SWOT analysis? Okay. Dr. Guy is familiar with SWOT analysis. This is her addition to the talk, her main addition to the talk. So basically, to analyze more closely what you're going to do and help hone your project, you do what's called a SWOT analysis for strengths, weaknesses, opportunities, and threats. So strengths and weaknesses come from inside. Like a strength is, we have a really solid group. We have 3 NDs. We know some celebrities, whatever it is. We've got a good marketing person. Weaknesses, we only have NDs. We only have 3 NDs. We don't have anybody else who knows what they're doing. So inside stuff, not outside stuff. Opportunities and threats are outside things. So an opportunity might be, there's an abundant natural resource. Like you can grow a cash crop really easily. There's a project that's doing this in Uganda right now. Something else that you know is really good about the area, or its people, or resources. Threats would be the opposite. There's an unstable government. It's not you, it's not internal, it's outside, but it could potentially disrupt what you're doing. Or some cultural beliefs that are in the way. And the idea is then to turn the weaknesses and threats into strengths somehow, or make a plan to make them better, and then augment your strengths and opportunities. So go ahead, draw a box, or just type a list. It doesn't really matter if it's visual or not. Whoever's the note taker. And start working out in your area and kind of, with the population you're looking at, do a brief SWOT analysis. Take about 5 minutes max. And introduce yourselves too. Do that first. You already kind of did that because you're friendly NDs. So we have India and NWB. Burmese refugees. We should do it in Nigeria, sickle Ren is like West Africa. They chose. I had
So it's already an organization.
Yeah.
So that could be a strength.
Yeah, they already.
Exactly what you're saying.
We did that, but in Thailand. I don't know if she's in Yeah. Sort of.
Is it also NWB or?
No, that was at the self-storage.
Yeah. Well, I'm not sure about. I wouldn't put that as a weakness before. Because there's a lot of things.
That would be our.
Some people, some are stronger than others. Some.
How did you guys set that?
Is it sort of like stronger
She
ones?
just emailed us.
I was gonna say it's a new one, so that's probably it's already exists like 501c whatever, but it's a new organization.
No.
Well, I mean, they just started.
Well, that makes sense. It's nice because like you said, they already have.
Yes, another one going on right now. Nigeria, but
So it would be one of the smaller ones.
I have
That's different.
And I mean, that's some other things I have to find exactly, but I know
people
that
actually from
there are some fundraisers, but I'm not sure.
Okay, so strengths and
It depends what part you are. It's run by a military government.
Yeah.
It's not set up like it is.
I'm not very knowledgeable.
Just beefed up.
I'm willing to learn.
Willing to learn.
These are outside projects.
They say that most people who have the trait, I'm not sure if it's valid or not, but they say people who have the trait, who have the disease actually like phenotype, they were not very disease actually. But she got the trait.
So that's an opportunity.
Yeah, so part of this, we're talking about Thailand, like a lot of into it, or like these subjects, when they get the alternatives, like in Thailand.
It's just like, I guess he's going to say, you can see like, this is what you have to do.
What's the name?
Omega Care.
I mean, I would like.
Yeah, I found out about this organization too. Fascinating. Yeah.
What was new?
Maybe mobile opportunities for here, like throughout the year, you also make positive things.
Alright, so weaknesses.
Yeah, there's.
Made them sustain themselves.
Yeah.
If you taught some people on how to understand how to feed healthy foods, maybe dentist doctors.
Yeah.
Clinics that are
Pictures and all the
here, maybe to.
It's an opportunity. It's in a fairly decent location. It's not too far from the capital. Oh yeah, they do.
But threats would be government. Oh, opportunities would be, there's tons of
Locations.
teaching,
There are a lot of other people, not in the capital, but it's like 4 hours from the capital. That's an opportunity. You can fly in and out, like to leave the country. That's a major
And how they like receive things.
Is there a hospital in that town or?
yeah.
Yeah.
And that's specific town, I don't know, I haven't been to that.
Everything Canadian.
Is there
Well, Canadian now, no, Canadian, so Ethiopia is Canadian. Egypt, they have government threats right now.
wherever you're
So, I mean, I don't know if people like it.
Do you know people there?
Canada's fine. There's a lot of poverty.
It's a good start.
In Kenya, but the government is more stable.
Looks like it's based.
It could be a weekend.
We stick our share.
Yeah.
Here's turning. Okay, does everybody have at least like one thing down for each? That's a start. All right, give me a strength. West Africa Mobile Clinic.
East, I misspoke.
East, oh, he's switched. Gotta redo your SWOT. It's claim.
We volunteer in multiple global health organizations throughout the world, in different countries.
So you've got some experience on board.
Yeah.
Good. Weakness?
As far as in,
Internal.
yeah, like language barrier and we're not as familiar with the culture. I don't know like the business side of setting up a global health organization as well.
Well, next few weeks.
Here.
Yeah.
Change that.
Yeah.
Opportunities.
Room for growth, location.
Growth, location.
And the need for what we want to provide. It's a great need.
Right, there's a vacuum and you're gonna fill it and it's gonna be great.
Yeah.
Good stuff. Anything surprising? Like, someone had a really brilliant thing that no one. You're all smart.
I mean, an opportunity, I guess, main idea is that it would be feasible to kind of integrate naturopathic principles into like the Ayurvedic. Seems we already learned some of that, and I do a lot of homeopathy there, so they might be familiar with a lot of the types of medicine that we do.
Right, so you can blend in easily with the culture.
And hopefully get like doctors from there to join in.
Collaboration. Reds? Or anything interesting?
Threats, yeah, well, possible government resistance and also the weather. So during the rainy season, there would be a lot of mudslides and that would be hard transportation and bringing supplies.
turned into opportunities?
Yes.
Yeah, well, you can make sure you go during the right time of the year. And you could also, most of the transportation that I saw was done by motorcycle, and so if you're able to rent a vehicle that would be able to withstand weather a little better than that.
So get a good vehicle.
Yeah, and also doing your research for the government resistance, there's a lot of research that would have to be done, and before you go, and so requiring any visas or work permits or any other legal documents that you would need to be in this area and to do the work that you're going to do.
Right, so preparation mitigates that potential resistance if you know what you're dealing with. And I'm going to make a leap and say most of these countries, it's kind of about who you know. So if you can reach out and find some Burmese people living in the United States, maybe you have a friend, or you can, I don't know, Craigslist, like meet up, I need to find someone from Burma and talk about this project or something. Maybe they know people there and it's turned into a strength. Now you have allies in the country. So yeah, try to flip those weaknesses and threats. So integration, startup versus augmenting another project. So if there's like Lucci said, a big vacuum for what's going on here. There's no sickle cell education going on in Nigeria. This is a huge thing. You got to think, should I make my own nonprofit that's doing sickle cell education, or maybe find someone else doing something similar, another public health education thing, and add on to them? Either pitch it to them or just kind of start emailing, start talking to them, helping them with other things, and then saying, I'm seeing this huge void of sickle cell, what do you think? How about we start a project for it, just to pilot, see how it goes. Or just start with a needs assessment or something like that. This is one area where I'm going to give a personal lean toward augmentation over startup. And it kind of depends. If everybody's going to be hostile to what you're doing, maybe you need to go it alone, or maybe you shouldn't be doing it. Maybe part of that hostility is because they don't know you. And going in with someone who can vouch for you is going to help. So, there are reasons for each side, but I'm going to say in general, the purpose of this series is not to create a bunch more naturopathic nonprofit startups that most of which will fail. I'd rather strengthen what you are able to do and go out into the world and augment existing systems. So, kind of the same thing going alone, parallel system, meaning let's start giving care, the best care no matter what, versus let's look at what's already there, let's integrate with, say, the government and their statistics, etc. So one big question to ask yourself is what happens if you or your organization leaves? So this is an aspect of that sustainability, that double-edged sword that we talked about earlier. If you are integrating well with other organizations and with government, hopefully you can kind of design yourself out of a job so it can run itself. That's the ultimate goal, and it's going to take time to get there. So let's, in your groups again, quickly, make a one-sentence initial statement of purpose. So where are you going to go, which most of you already said that. Who are you going to serve? How are you going to do it? Why? And then maybe with whom? And just write it down. 30 seconds. Remember, 80-20, don't make it a paragraph, just like a sentence. Like, we're going here to work with these people this way because of this. We're going to do it with these other people.
I mean, we don't have anything. I just have that question. Sorry.
Anybody done yet? Or able to make it up on the fly? No? So that,
It's sort of a choppy sentence, but.
so
Oh, it's supposed to be a
So,
sentence or a word?
it's a long sentence, but you should be able to
Going
describe it.
India to serve mothers and babies because so many die in childbirth, in order to educate both the community and other health workers to prevent unnecessary deaths, labor complications, while providing pre-postnatal care, women's health, and pediatric care.
It's basically a mission statement. Pretty slick, huh? No?
Ours is like,
It's getting there?
Oh, okay. I guess I didn't get the memo. I just did like words instead of sentences.
You can make a sentence out of words.
Okay, so
Most of them
where-
are made of words.
Yeah. Okay, so where Nigeria and initially in Western Africa.
Okay.
Food, the unhealthy, those in need, especially initially starting with sickle cell patients.
Just say sickle cell
Sickle
patients
cell?
for now.
Okay.
You don't want to go too broad, then you can't help anybody.
Okay. How through docere and providing health services.
So education and services.
Yeah, education and health services. Because there's a need with whom and those who are willing to help in different organizations that are already
Such
Yeah.
as
such as Omega Cares, students of
Omega
SNM,
Cares. Yeah.
whoever's willing.
And yeah, and whoever else. You guys already, sorry.
Well, the other ones were very good.
Just
So, I think this is thought-leaders. But go to Thailand to work with Burmese refugees to provide healthcare access to the underserved and provide education for sustainability of the project.
Sounds good. You gonna work with anybody?
I mean, this is, yes.
Yes, good.
Yeah.
Good.
There's a lot more that would have to go into this. This is just,
Right, you
something
don't-
in my mind.
You don't know yet, but you know you want to be teaming up, right?
Oh, definitely.
Maybe there's somebody already doing it. I know there's a naturopathic group somewhere in that area, like Thailand, Cambodia-ish.
Oh,
It
nice.
works on the border with some kind of refugees. There are a few groups in Nepal. There's stuff in Southeast Asia that's happening. So. All right. All my talks try to put a Bruce Lee picture in. So, because of styles, people are separated. Research your own experience, absorb what is useful, reject what is useless, add what is essentially your own. So I'm going to very briefly go through some different models and think about Bruce Lee when you're looking at these. Take what you think is good, what isn't relevant to your project, just ignore it, apply the 80-20 rule, and then add what is your own, like specifically the Burmese refugees, or you've already got the sickle cell connection with Omega Cares. So Outreach 360 is an organization that I have volunteered with. Dr. Sarah and I have both volunteered with. It's run by a family friend of hers. The focus is on volunteer experience. So it's kind of known as an alternative spring break. You could see, I took the front page of each of these websites. Boom, volunteer, student scholarships, we're a leader in volunteers, volunteer. It's very focused on providing an excellent experience to college-age kids and some high school kids. So programs, English school, they integrate within local schools and send people to go in and teach. Community health education, spring break clinics, and construction. They work in the DR in Nicaragua. So very brief overview. Remember, we're not talking about the marketing and fundraising and all that other stuff today. So you can have a volunteer-driven organization. The fees will help drive what you're doing. The volunteers help push what you're doing, so you give them some limited training and have them run with it. Meds and foods for kids in Haiti. Feed malnourished children and vulnerable populations. That's basically their mission statement. So you see here, there's a dude holding peanuts. This is about carnival, this is kind of temporary. Mission statements right there. Big malnourished children and vulnerable populations. So it's very localized, very Haiti local, vertically oriented. So they buy peanuts from the Haitian peanut farmers. So they're actually kind of supporting an industry. They're the largest buyer of peanuts in the area. Factory and management in country, they employ a lot of Haitians full time. They've recently just expanded their factory. In-house quality control, they sell and grant to NGOs, and those NGOs distribute the product. So they're not just handing this out to people. They're kind of, again, augmenting. And they do some research on the side too. Partners in Health, which is my favorite global health organization. This is not actually the front page because they have news, but I would say one of their claims to fame is they've run a very successful community health worker program, which means they take lay people and train them in basic care. They have a network of clinics all over the place running under the same model. They're working more and more as they go with government organizations. Free primary care. There's some pros and cons to making care free versus charging a nominal fee. Education, community health workers, government partnership, research, they have a very strong binding philosophy. So we only have, kind of have negative time, but screw it, let's go. I've already discussed location integration, so let's go a little bit deeper. So, what is making these orgs work? So comparing and contrasting them. So as I already kind of highlighted for you, the Outreach 360 is very volunteer driven. They do work with some other organizations on the ground, but largely they're basically trying to provide that experience. Meds and Foods for Kids is working very closely with other organizations because those are the delivery arm of their product. They're also working very well within industry. Whereas Partners in Health is also doing that with other organizations, but they're trying to make kind of a model healthcare system that countries can expand upon. So, Lisa's breaking in here. So other attributes that you'd like to see to make a project work, we're just going to kind of skip that. Let me give a brief explanation of the commander's intent, which basically defines the purpose of an operation, enabling subordinates to quickly grasp the successful end state and their part in achieving it. So Tracy's been in the military. She knows about the commander's intent.
Yes?
Yes.
Is that what you
It comes from the military. So basically it enables autonomy and decisions consistent with the mission and vision so that all the people in the organization make a decision that's consistent with the mission and vision. So I'm going to go briefly over the NWB project checklist, and maybe next time we'll kind of brainstorm our own. So also the making of a bad acronym, which you'll see. Maybe you can help us on this. So ethical practices. The more of these things that we have on this checklist, the better off our projects are, and the more consistent they are with our mission and vision. So think about these in your own project that you're all working on. Empowering the local community, empowering people rather than going in and giving them something. Sustainability, again, financial and with your people. Solidarity with the local people. Innovation, maybe you invent something new that nobody's tried before, then everybody starts adopting your idea and it changes the world. Improving access, or as they call it in Partners in Health, and Liberation Theology, a preferential option for the poor. Collaboration with other organizations and everything that's going on the ground. Cultural sensitivity, capacity building, and scalability. So being able to increase the size of what you're doing. Spells SEACT, like SEACT? Not so bad. Acronym, huh? It's just too long. So we won't really have time to tie this in with your statement of purpose. But for next time, start thinking about mission vision statements, which is just going to be a minor tweak on what you've already come up with, which takes other organizations months, and then they come up with something that's too convoluted, etc. You almost have a mission statement right now. People you want on your board, continuing improvement in the organization via monitoring, measurement, marketing. Just start thinking about them. We'll explore them more next time. Homework for next time, networking. Find a global health conference to attend. Don't buy your tickets necessarily. Just start looking around and seeing what else is going on in global health. Hard to collaborate when you're like, la la la, and I'm just going to go into this country, right? Know what else is going on. If you go to like the Unite for Sight conference in April, that's a there are 3,000 people there, and they're all doing something. And some of them are students, some are doctors, some are dentists, some are just MPHs, etc. And that's a great way to network, is going to that conference. And then research one non-naturopathic global health organization, someone doing something else that has those lessons that you can Bruce Lee learn from, and maybe learn what you don't want to do. Like, oh, they do a lot of this like refeeding stuff. I'm not that interested in that. I just want to do care, or I just want to do education, etc. Email me feedback. This PowerPoint's supposed to go up on the Career Center website. Hope that's still going to happen, but I'm curious to know what you liked about this, what you didn't like, other than running out of time. Give me a little slack. How would you fix? What did you learn? And then how strongly are you considering a part-time or full-time career in global health? And then has this talk affected that at all? I hope it's empowered you a little bit to at least get the gears turning and think about some different things you could do. So, winded. Enjoy. We're getting kicked out. See you next week.
Thank you.
Tell your friends.